difficulty with me when I'm wearing my mask. Television people, can I proceed with the mask on? With the mask on? What is yours? Okay, should I? Are you fine with that? As long as you have your masks on. Thank you very much. The purpose of today's media briefing is to outline how we are strengthening the Gauteng response to COVID-19. We particularly have chosen to look at strengthening our health response in a number of areas. Let me take you through what our pillars are. The pillars of our health response would be a comprehensive health response, food security and social relief. A comprehensive health response is because health, the Department of Health is responsible for spearheading and leading the province response to COVID-19. This is a health pandemic. It's a global health pandemic. So the Department of Health must be in the position to do so. Food security and social relief. COVID-19 has had a huge and devastating impact on the livelihoods and well-being of many people. The depth of poverty has deepened and expanded, particularly urban hunger has been brought into sharp relief. And I would like particularly today to pick up on an area, our economic response. So today I'm going to be speaking to you on how we are dealing with three areas: strengthening our health response, strengthening the response to protect the most vulnerable sections of our population with regard to food security and relief measures, and strengthening our economic response. So all the issues that revolve around these three areas, I'm only focusing on these three pillars today. Looking at the opportunity that we have to fill the vacancy for the MEC for Health, we have approached this issue to strengthening the health response to take into account that we must also look at opportunities to strengthen these two other areas: our economic response and our food security and social relief response. And as a result of that, I'm going to take you through later to the details of each area. As a result of that, I'm looking at strengthening also the Executive Council. So strengthening our response with regard to health, with regard to food security and social relief, which is basically social development and economic response, gave us an opportunity to also not just look at health. So what I'm saying to you today is that I'm therefore also announcing how we are strengthening these three areas that are so critical for healthcare. We will strengthen our health response as follows. Firstly, I'm announcing the appointment of a new MEC, but also announcing the appointment of an intervention and support team in the Department of Health. I've been saying it to you. I'm going to announce the names of the team, the new MEC of Health, and the team that's going to support him. I'll come back to the presentation with regard to that. And also I'm going to announce a cabinet reshuffle that will look at how to strengthen our economic response, as well as how to strengthen our food security and social relief response. The MEC for Health in Gauteng Province will be Dr. Nomathemba Mokheti. Dr. Nomathemba Mokheti is the MEC for Social Development at the moment, and I would like to say to the people of our province, she has got 27 years experience of working in both the local government and health sector. Her training is in healthcare. She was a nurse in one of our local districts in the West Rand. She has got a master's in nursing science. In fact, she's got an honors and a master's in nursing science and a doctorate in literature and philosophy from UNISA, but even in her doctorate, she focused on matters pertaining to healthcare, especially HIV and AIDS. So that's the MEC I appointed in the area of health, social relief, and food security. But for her training and experience in this sector, I'm moving her to the Department of Health to lead our health response. She has already, in the last few months, done extremely well in beefing up our response in protecting the most vulnerable groups. I'm bringing in that area of social development, MEC Murakani Musupye, who's currently the MEC for economic development. And this is extremely important to understand. MEC Musupye was the chairperson of Social Development Portfolio Committee in the legislature. She served in the city of Tshwane as the mayoral committee member responsible for health and social development. So what is her greatest strength is in the social sector. And our approach is always when you have a team, play team members to their strength. That's why I'm saying to you that MEC Musupye has chaired a portfolio in the city of Tshwane in the area of health and social development. She has chaired a committee in the legislature responsible for social development. Her greatest strength is in the area of social development, working with communities, working with the excluded, working with the marginalized, women, people with disability, mobilizing people around our campaign to eliminate gender-based violence. That's already her greatest area of strength. She has been holding the fort in the economy. We want to strengthen this area because the food security and food relief is critical. Just during COVID, we were able to assist 2.8 million people in Gauteng with food relief. That department is critical to help us respond to urban poverty and hunger. It's an important department, and we are playing this player's greatest strength is in that area. We are moving from economic development to social development. The third area, economic response. Gauteng is the biggest economy, not just in South Africa, but in the SADC region. We are the industrial hub of sub-Saharan Africa, the driving engine in terms of manufacturing and agro-processing. We are a critical player in Africa's economy and in the global economy. And in that sense, after substantial consultations, particularly with the national officials of the ANC, I am glad to announce that Mr. Pakstau, who is currently the Deputy Minister of COGTA, will complete his work in national government and parliament this week. This is the last week before parliament adjourns. He will complete his reporting this week to Parliament, and he will be sworn in next week as the new MEC for Economic Development in Gauteng. You know, Mr. Pakstau has got substantial governance experience. He's a seasoned administrator, but he also led this portfolio of finance and economic development in the city of Johannesburg. You know, Johannesburg constitutes more than 1/3 of Gauteng's economy. So in that is this player's greatest strength includes in the area of leading the portfolio of economy, environment. He also was responsible for development planning and environment and transport in the city of Joburg before. He's got vast global experience working with global bodies. The MEC for Economic Development in a province like Gauteng requires that global experience and the global networks to attract investors into our city region. And he is also vast experience in working across the different spheres of government. So he will be, as I say, he will complete his work in National Parliament, and next week the ANC will complete its administrative processes that comply with the Gauteng legislature. This is an ANC responsibility. The ANC will complete that to ensure that Mr. Pakstawu is sworn in the legislature. Obviously, doing that means the ANC will be able to ensure that one of the members of the ANC is redeployed across from the legislature. That's an ANC process. The ANC is finalizing that, is doing its consultation. But the decision that we have made, firstly, as the Premier, in consultation with the leadership of the ANC in Gauteng province and the leadership of the alliance and the national officials of the ANC, is that this is a reshuffle that will strengthen the Team Gauteng's response both to COVID-19 immediately, but to the challenge of rebuilding the economy and responding to the pressures that many millions of our people are facing, especially those who don't have employment, and ensuring that we can provide proper social security and respond. So these three areas are critical. The rest of the Executive Council will remain the same. I would like to take you to the team now that's going to health. Strengthening the health department's response is not just about appointing an MEC. I've briefed you previously several times that health has got deep structural and systemic problems that range over the last decade. And those problems would require a particular approach that will also help us tackle them in a systematic and sustained way. And that is for that reason that we are not just appointing the MEC for health, we are also appointing a team of seasoned administrators and health professionals who are specialists in various areas, some in healthcare, others just in organizational management, others in finance, others are clinical specialists in that regard. So in that sense, let me specifically say that some of the areas that this team, this support and intervention team that is going to be supporting the MEC, the new MEC for Health, will also look at driving our response to COVID right now. The surge and the real possibility of a big second wave is there. Last week I spent time explaining that we need to do everything to ensure we don't lower the guard in Gauteng province, but we must be sure that the Department of Health is absolutely ready. The team, the intervention team's immediate task is to ensure we are ready, but the intervention team will also work looking at the whole organizational structure of health and look at how to strengthen our primary health care structures, how to ensure that the decentralization of responsibilities from the center to the base, how to strengthen institutional leadership of our hospitals, including decentralization and devolution of certain functions that are at head office, but also how to deal with what has been a systemic problem about financial governance, irregular practices, corruption, sustained areas where the department has been caught involved in acts of corruption, but also how to improve planning, monitoring, and evaluation of the performance of various institutions of the department, and strengthen the human resource function in the Department of Health, from the head office up to the local level. Often what we get from clinicians is that the department is top-heavy. Clinicians tell us about the gaps that are there in the system, the requisite human resource required in the cold phase of service delivery. So this team of experts in healthcare, but in management and administration, will support the department to focus on achieving this time round, turnaround. Because there's been many processes previously where turnaround has not been achieved. We have had teams and analysis of the problem. We no longer want analysis of the problem. We want to achieve a real turnaround that can be felt on the ground, particularly with regard to our primary healthcare institutions and these critical institutions that we call centers of excellence, which our province has. Improve their resourcing, improve their management, also improve their infrastructure, some of which has been done during COVID. They will help us also deal with issues related to information systems, health information systems, the district management of our healthcare system, improving district management in that regard. So I would like to share with you that the intervention team, firstly, the MEC is the key person. The new MEC, Dr. David Makhura, is the key person. That team basically reports to him. Currently, we've got the acting HOD, HOD Malotani, who is also a key member of that team, the acting HOD of health, but the DG in the Premier's office is a member of that team. And we've been given 3 names by the Minister of Health, because I've been saying to you that I've been talking to the National Department of Health to also help us provide 3 names. Those 3 names are of particularly health specialists, Dr. Zetu Tunta, Dr. Keith Shongwe, Dr. Percy Mahlati. These are the 3 names that the Minister has given us to reinforce the Gauteng Provincial Department of Health. These names now, combine them with the following additional names. In fact, just yesterday, Dr. Letitia Rispel, who used to be the head of Department of Gauteng Health, just came back to me after we've been meeting with them that she will no longer be able to take up this appointment due to she's currently a professor at Wits University, focusing on health systems. As I say, having worked on this yesterday, she came back to me to say, Premier, I have some commitment overseas. I would not be able to help you. But Roland Hunter focuses on finances. Some of you may not remember Roland Hunter was the treasurer or head of treasury in Johannesburg at the worst of times when Johannesburg was being turned around, when the city of Johannesburg had major institutional problems. It's a very seasoned financial public health finances. He's going to focus on finances. Ms. Adimo Chabe, who used to be in Gauteng Department of Transport. Her area of specialty is in corporate management and human resource. Health has got significant issues pertaining to finance, as I said to you, also pertaining to HR-related issues. The doctors I have referred to earlier will focus on healthcare, and that's where the next person in the team is Professor Murauzi, Professor Mpereke Zeni Murauzi. She is playing a key role currently at Wits University. She is one of our clinicians. She's the key leader of the clinicians in our province. She's also a member of the Premier's COVID-19 Advisory Council, but on issues pertaining to the clinical challenges faced by the Department of Health and how to support the clinical interventions that are required. She's going to focus very much on those issues. And the 3 doctors will also help. This department must be ready for the national health insurance. We are dealing with COVID-19 now. This is the biggest healthcare system in Southern Africa. We are dealing with COVID, but we are dealing with other pandemics. Yesterday, we were looking at the HIV and AIDS numbers. Just during COVID, the province has fallen back with regard to our performance on dealing with the HIV and AIDS epidemic. So it is also very critical, and part of the reason is because in other areas like TB treatment and the treatment of other comorbidities and access to health services outside COVID-19, we have fallen back. As we're dealing with COVID-19, the focus on COVID-19, we have fallen back on dealing with matters pertaining to HIV and AIDS. So this team will help us focus on jacking up the entire healthcare system in Gauteng province under the leadership of Dr. Nomathemba Moeketsi. So the rest of the issues pertaining to our healthcare system, we are monitoring the COVID cases very, very closely. We can say to you that we have raised this concern, but we can see on a 7-day basis, every 7 days, the number of cases reported are increasing. We've just looked at the last 7 days. We have, in our province, we have recorded over 1,800 new cases in that period. That's a matter of great concern to the province. We want to emphasize that we may not be where the Eastern Cape is and where the Western Cape is, but like it happened with the first surge, particularly as we get to the end of December and the beginning of January. This is the news we must communicate to the people of our province, that all indications are that we are going to have a significant increase, but we can do much, much better by complying with the health protocols in our province. The strengthening of the health department will also give me and the people of our province the confidence that we are not relying on a department where you have had people who have resigned because of the investigation or who are suspended. We now have additional capacity to help the acting HOD and the senior management team under the leadership of the MEC to focus on how to strengthen this department from bottom up. I want to emphasize the approach on strengthening this department must be bottom up. In the past, all interventions looked at the head office of the Department of Health without improving the functioning of these critical primary healthcare agencies. And I would also like to say that the district healthcare system is crucial. If the districts are stronger, they have strong leadership, we have invested significantly in the expertise, and we have ensured that every district has a fair share of health professionals that are required, community health care workers, and the various specialized and allied services and professionals, allied professionals in healthcare are also there at district level, and we have strong leadership. The CEOs in charge of our hospitals and the managers in charge of our district are fairly capable people. Doing that will help us a lot, not just in responding to COVID, but also in responding to the new increases in HIV and AIDS. We are deeply worried that Johannesburg and Ekurhuleni are showing new increases on HIV and AIDS. I said this on World AIDS Day yesterday. So we mustn't just look at COVID-19. Increases in HIV and AIDS are of great concern to us. And our response, so we are responding to multiple pandemics, basically. Our response to COVID must include a comprehensive response to HIV and AIDS, make sure we achieve the 90-90-90. People test, 90% of people with HIV and people know their status. And those who have tested have tested positive, 90% of them must be on medication or on therapy, antiretroviral therapy. And those who are, 90% of those who are on therapy, we must see evidence that there's viral suppression. You can't do that if the healthcare system is weak. So this intervention of strengthening the healthcare system will help us do that. As I've said earlier on, it's not just only about health today, it's also about strengthening the other important areas of urgent priority. Every time we talk about COVID, people say to us, Premier, what about food? And then they say, what about jobs? So we are saying to them today, we have answered not just the health, the COVID issue, we are also answering their question about enhancing our response to protect the most vulnerable by putting players to their greatest area of strength and enhancing our economic reconstruction and recovery. Gauteng needs to be the leader in the reconstruction and recovery of our country's economy. That plan implemented by President Ramaphosa. We must be in the forefront of leading this and ensure that every sector of our province can see that we are really dealing with these issues. COVID was quite severe in its impact. It had multiple impact, but these three areas are critical. We are satisfied that the law enforcement and compliance leg is doing well. Mobilization of the grassroots is doing well. Mobilization of local government in that area, we are doing well, but we want to improve our overall response in this area so that we can build Gauteng together. So that's really the long and short of our briefing today. So the provincial secretary of the ANC is leading the processes of the ANC to ensure that we will have Mr. Pakstau in the legislature as a member, sworn in as an MEC for economic development and agriculture in Gauteng province next week. Thank you very much, Thabo. I think I covered, you remember these guys always prepare very long, detailed stuff. Today I cut to the chase. They like me to say all kind of things. Kwara like me to say all kind of things, Thabo. I cut to chase. You will get that. We are strengthening healthcare. We are strengthening our economic response. We are strengthening our response to improve social relief and food security. We are ready for questions.
Thank you, Premier. We will now take questions. Can we have the mics moving around? And as you know, I'll ask you to just introduce yourself.
Premier, it's Ndaedzo from Power FM. Just two quick ones for me. Why did it take so long for you to appoint the MEC of Health? I mean, to me, it looks like it was pretty much straightforward. You could have just shifted the MEC of Social Development to Health, and it would have been a done deal. And the second one, I've just seen a report showing that the National Coronavirus Command Council has recommended some strict measures in hotspots. I know Gauteng, so far we are not yet, or we are not a hotspot, but would you agree to stringent measures going into the festive season that would be implemented in hotspot areas, considering that you are the economic hub of the country and it might have some form of economic impact should it be applied across the board, these restrictions? Thanks.
Okay, thank you. Ndaizo. Yeah.
Hi there, it's Yanda Ngobo from Newsroom Africa. It's sort of linked to my colleague's question, but the last time, Premier, we were here, you'd said that you were asking the Health MECs to step aside pending the completion of that SIU report, which we know hasn't been completed. So if you could just clarify for us, what exactly changed, Premier, for you to now actually reshuffle your cabinet, and was your hand forced in this regard regarding the change within your own cabinet? And then the second question I have is related to that News 24 article on the NCCC's meeting yesterday to extend the curfew. I'd just like actually specifics of where the hotspots in Gauteng are, and whether or not you would also then be agreeable to actually implementing a curfew earlier in these particular hotspots, and also curbing the sale of alcohol in these particular hotspots during the festive season. Thank you.
Okay, are there other questions? All right, let's.
Good day, Liza Gatando from News 24. Premier, I just wanted to ask you three questions. One is on speculation that you had asked the President to release Dr. Ramaphosa to come into your cabinet. I want to find out if that is true or not, and if you did ask the President, what was the engagement like? The second question is around, also yesterday, last night, we heard a lot of rumor about, well, the ANC Youth League even released a statement about you as well as the PEC wanting to purge their own in order to recycle the elders, as they called them. I wasn't here earlier, but could you share if who exactly resigned in order, or had to step down from as an MPL in order to ensure that Mr. Parks Tower returns? And also in terms of the NCC report that News 24 just published, given that we don't have an accurate understanding of whether there are hotspots here in Gauteng, and there's been allegations that you have inaccuracies in your numbers in terms of COVID-19 during the past couple of months. Can you concede that you've had a problem there, a challenge there in collating your numbers in terms of your regions and your districts? Thank you so much.
Slinda Lomasigano from ENCA. I'm covered by most of my colleagues. But just for clarity, Premier, what swayed you or what changed your mind in terms of bringing Parks Tower in? Because we did see that media release from the ANC Youth League. And just to add on to my colleague's question as to who actually had to step aside for Parks Tower to come in. Thank you.
Okay, I thought, yeah, that's fine. The Premier will ask. Oh, let me just check. There are a few that I got here on WhatsApp. The Premier last week expressed concerns. I don't see the person who sent this here. Is it from Mark Haywood, News 24? The Premier last week expressed concerns of a possible increase of cases when people come back from December. Is there are there any practical plans to deal with this? And the second question from News 24 again, what is the plan to boost the economy during the festive season? But also bearing in mind that COVID-19 remains. And then, it's from Luandi Lebengu. And the other question, this one I suppose is from Mark Haywood. The Premier promised there would be a civil society member, but there doesn't seem to be anyone. That's Mark Haywood from Daily Maverick. Those are the questions, Premier. I see that a lot of questions are about the NCCC, which the President obviously speaks about the NCCC, but the Premier is now asked to speak about the NCCC. I'm not even sure if there's been a meeting of the NCCC. But the Premier will be able to deal with the issues, including what he had explained earlier, that there are processes which are being dealt with by the ANC. But I see the colleague who asked said she was not here when you said that. Okay.
Let me start with the last question, especially the question on civil society. Mark, we are definitely committed to having a civil society representative who will add a great deal of value to the work of the intervention and support team. We call this an intervention and support team because it is not a takeover of the department through Section 139 or Section 100. It is a team to help the MEC for Health to achieve a turnaround, but also to bring along those very committed professionals in our healthcare services who are not involved in malfeasance, who are not involved in corruption, but who often have to endure when there is a problem that takes place because things were not done properly in that area. So we would like those to be brought along. So Mark, we will definitely have a civil society representative. I had said earlier on that Professor Letitia Rispel had just indicated also that she is taking up another task elsewhere. So she came back to me after expressing a lot of support for this process to say, I'm sorry, Premier, I have to take up another task somewhere else. So we will replace her with another healthcare professional with a great deal of experience and depth, but we will also have a representative of civil society. Civil society is important because the feedback we got yesterday on HIV and AIDS